Have you ever wondered why is gut health so important when it comes to thyroid dysfunction management? You must have often heard that the alternative medicine doctors always keep talking about rebooting your gut health. And that is because whenever they talk about gut health, they are actually referring to the liver health. Liver is one of the most crucial organs when it comes to the functioning of thyroid gland. So what is the connection between the two? There are basically four main functions that happens between the thyroid gland and liver function. One, it is in the liver that the conversion of T4 to T3, that is, the formation of the usable form of thyroid hormone happens. And only when the T3 is properly formed, the cells all over the body will be able to avail it and get energy out of the same. 2. If the thyroid gland is sluggish, it leads to impaired lipid metabolism, leading to hypercholesteremia or raised cholesterol levels. 3. In case of hyperthyroidism, it leads to LFT deformity. And the fourth and the most important one, though not very commonly seen, it is bilirubin metabolism. When the thyroid condition is not treated for a long period along with pitta imbalance, it leads to a condition called Kamala, wherein there is yellowishness of skin, and that is called jaundice. So these are the four factors which helps us in understanding that there is a concrete connection between liver and thyroid gland. So why is it so important to understand this connection? While trying to treat the thyroid condition Ayurvedically, we try to first focus upon the gut health. With the correction of gut health, the load over the liver decreases and thereby the load over the thyroid gland decreases. Once that happens and once the anti-inflammatory management is completed, then we try to rejuvenate the thyroid gland by giving the optimal amount of fat in medicated form. And after that, again we try to reboot the gut. And that is how we Ayurvedically manage thyroid condition. So what can you do about it? There are three main changes that you can bring about by knowing about this. 1. Try to avoid fat-rich food, meat and chilled beverages. By removing this, the load over the liver decreases and thereby the thyroid gland will be able to function efficiently. 2. Try to avoid adhyasana. Adhyasana means overeating. Every time you do overeating or you eat a meal before the previous meal is completely digested and out of your system, it adds on to the pressure over the liver. And therefore, the liver has to struggle, wherein the proper conversion of T4 to T3 doesn't happen and you end up feeling fatigued and tired. And the third and the most important one, avoid remaining awake between 10 p.m. to 2 a.m. That is basically Pitta Kala, and during the Pitta Kala, the liver, which is the powerhouse of Pitta, needs to rest. Only then it will be able to shrink and get back to its normal health such that the next day it can function effectively. If you have noticed, if you remain awake at midnight, you can feel hungry, right? And that is because of this Pitta spike. So therefore, try not to remain awake through the night or especially beyond 10-10:30 p.m.